except you're gonna come tomorrow, right?
I still have to hear from my team leader regarding
Okay, whatever, it's not,
if we need to do the
Whatever.
discharge, wherever.
we don't wanna be much concerned about that right now, all
Well,
that.
my concern would
paperwork.
be if, let's say, Leslie stays on hospice, and then Mayo, whoever does the scan, says, well, you are responsible for the bill because Medicare is not
Fine,
paying.
I said, don't worry about it. We're not gonna pay it. We're gonna send it back to them and get the paperwork straightened out, and that'll be it. We'll resubmit it.
Get the paperwork straightened out by who?
But who, you and Mayo, I guess, if that's the problem. Is that what you're concerned about? You getting the coordination between you two wrong?
The insurance will not cover both. The
Yeah,
insurance will
well,
not cover both.
but, look, what I'm saying is, do whatever has to be done to implement that, okay? And like I said, there's very little that can be done,
Okay, before.
right, before we find out. Right. We probably won't know till Monday or Tuesday.
What exactly
And then
are
we'll
you
get
looking?
together again, and then we'll sit and finalize
Did
everything.
you, when you saw Dr. Ashman, did he say anything about what might be an option, what might be?
There's no option, he's doing the treatment. That is cancer and will be maybe radiated at one time or later, maybe. Most important though is the scan of the brain
Okay,
in regard to.
and after the scan, did he say, if it's this, we have these options, or if it's that, we have other options, did he say anything?
No,
So he just said, let's do the scan and,
and then he'll decide if there are options and what they are.
okay. Did you, Leslie, think about what you wanna do? Remember we talked, if you go, before you went to see Dr. Ashman, that if you go see Dr. Ashman and he says, you need radiation, do you want it or not? You need surgery, do you want it or
Well,
not? I mean,
Julie, she doesn't know that right now, please.
It's hard to
Okay,
know.
she's not into that at this point.
okay.
Let's
I
just
don't
leave her
know
be
they'll
and let her
do
relax
anything
and
more.
stay, be with her family here.
She was talking this morning
Yeah.
about
Bob,
it. She's made some decisions.
The issue is with the CAT scan, and I don't mean to keep hashing this, but we cannot go backwards as far as the billing is concerned. Because
Well,
if
what has
hospice
to
doesn't
be
cover-
done?
Well, it has to be determined if it's comfort care.
Who does that?
Well, right now, the bosses are looking into it.
Okay, fine. As soon as they
Okay.
give you, then you let us know
But
and we'll
is
go
there
from
the
there.
chance then to lose the hospice care?
Well, not lose.
No,
What
just
we
put
would
it
do,
aside.
we would put it aside, we would do a revocation, so that the bill doesn't come here, and that everything's covered.
Yeah,
And
then it
then
would
there's
be a
a-
heart attack if the bill came
Right, and I
in, on
wonder.
top of everything else.
Right, so,
You don't want
but
the
we
heart
do
attack.
we do have what's called a palliative home care, and that is just a social worker keeping track of what's going on with you while you're doing whatever you're doing. So I would fill the paperwork out for that, or who's ever covering for me if I'm off. Then they would put you on that particular program. I'm not sure I can advocate for the wound care, I'm not sure how that would work.
That's gonna be up to you guys, and
Yeah.
you'll probably have to let us know.
Well,
Okay,
we have time, it looks like, to have everything lined up by Friday.
Well, probably tomorrow, tomorrow morning, we're gonna know which way.
They're discussing it as we sit here.
Good.
So I just, because I was coming out here anyway, because to cover those things and a couple other things, I just wanted to make sure that I give you all the information you need.
Good.
I think we're getting into the minutia of billing versus who does what versus the bigger issue at stake here. And I know that as hospice, you guys can't just come out and say, look, here's what's going on. You know, here are your options. We had a good talk with Mom this morning, Kim and I did, about, and I've talked with you, Julia, a lot about, you know, where we are in this process. Kim, could you see if Bob could come out here, please? I mean, this is a conversation that we really need to all have.
And that was the other piece that we were gonna cover today.
Yeah, I think it's just getting stuck on the billing issue right now that that he's not able to get.
Unfortunately, they're tied together.
They are, but I think if we get to the point of whether or not we should even explore that as an option,
Yeah, because then you have to make a decision.
right, I think that we just need to figure out whether or not we really should go get the CAT scan. And I think if we decide that, then we don't have to worry about all that other stuff. You know what I mean?
Just, I don't know what you're talking about. Going out of hospice, is that what you're saying?
It depends on what kind of, and it goes along with that, with what your options are with the CAT scan. You know, if you had an option for treatment, would you wanna pursue that or not?
Now, what if we don't do much of anything?
Then you just stay right here on hospice.
Because I don't know how much is gonna go by. I don't know that.
I know we kind of alluded when I was here last week a little bit that, you know, things are changing for you. And that, you know, it's getting difficult to handle all those changes at times. You're talking about the increased confusion and your memory loss. That can be very distressing for you. And it's just hard to
Yeah.
continue that. And so we talked about managing each moment at a time versus looking ahead too far.
Hmm.
So just taking one moment at a time.
Yeah. Well, as far as I'm concerned, I don't see that you do anything unless I would go back to that and have it do what they want to do.
And so that's
And
where it's,
stay like it is.
right. That's where, Mom, it comes up to you because, and Bob, if you find out that the cancer has spread to the brain, which is what the CAT scan is, you know, okay, let's say that it has. Are you going to seek treatment for that?
Well,
Given-
again, she's gonna do what Dr. Ashman says.
No, she's going to do what she wants to do.
No, she's gonna do what the doctor says. She's not in a condition
No.
to make decisions.
That's absolutely correct, and that's exactly why we're having this
Dr.
conversation.
Ashman
Well,
will determine.
they may be, Barb, because I don't know.
She doesn't know.
My mom
No,
does know. We've
she
had these
doesn't know.
conversations.
Doesn't want any more treatment,
Her
She's
body
not
right
gonna-
now is in the dying process,
Okay.
Bob.
It's
It
not.
is. It is.
No,
Hospice is here. I know you don't want to hear this. This is.
No, I
I
don't.
know it. I don't
don't.
either, and that is why we are
and
here.
We can figure it all out as we go along. There's
I
no
know.
Sitting
Time to
around
figure it out.
planning missions like we're doing.
We have to. We have to do what's best
Alright.
for Mom.
Talk to Leslie. Just talk to her, please. Listen to her. Let her
What's
tell you
gonna
what
happen
she
is the
wants.
doctor's gonna
fine.
ask her
Let
what
her
she
tell you
wants
what
to
she
do.
wants.
The doctor's gonna say,
Yeah.
do you wanna have this therapy or not? She's gonna say
Because
no.
of you.
Right. That's exactly right. That's
She
what
needs to
happened.
hear from you, Bob, that it's okay for her to quit fighting. She needs to hear that from you. You need to go look in your wife's eyes and have her tell you, okay?
I just don't want you to know, honey, because I'm to the point where I'm kinda just, I just don't know.
I know you don't know.
So,
That's
we're
why,
not,
you know, I have to help you get through all this. And I don't wanna have all these mental gymnastics that are going
It-
on, and all this
heard
long
from-
talk with these people for the 20th time about what's going on.
we heard from Dr. Ashman, and
Yeah,
what did he,
nothing we can do until after Friday when he sees what it is. It could be something altogether different than
he
what,
may have nothing to do.
it may nothing to do there. Then, if you want, he'll do 2 radiation shots on that lump, and that'll probably be gone, and you'll be fine. All you need to do is recover from the bed sore, and you'll be fine. It's just like that.
Bob, unfortunately, it isn't. And that is why we are all here. Because
This is our business.
it's not just your business.
It's our
Come on.
business.
It's
Okay?
not.
I don't want this.
I don't either.
Well, then just
This
cool
is-
it.
This is
Bob, I am
ridiculous.
here
She
because
doesn't
we
know
love.
what she's
Bob,
Listen, this is difficult for everyone. We are here because we
don't what?
love.
I don't want you to think about it anymore. I'm not sure I want to go anymore. I
That's
don't know.
whatever you want is what I do, don't I?
If I
Don't
decide I don't wanna go.
That's up to you, whatever you want.
That's right.
And it never was ever said anything otherwise.
And-
Ever.
So let's not think about it anymore.
Right, that's what I'm trying to say. Let's just have some time that's some fun time. And Friday, we'll see what happens after that. We'll go from there. We need a little space.
I totally understand what you're thinking, Bob. I totally understand that. And the reason we are here is because Mom's body is in the dying process. And maybe, Julia, you can help explain that. I've been talking with
I
them.
know that. What do you think? I'm stupid? I know that.
Well,
I've
then
known that
why,
for months.
why would we,
what?
why
You're
would
doing
we,
what the doctor said
we
should
don't,
do.
it's up to her, and it's up to
And
her
that's what
comfort.
she wants to see Dr. Ashman, and that's what we did, and I don't wanna have to explain all this to everybody here.
I think it's best if we ask Leslie right now to kind of tell us what she wants. And to me, it's fine either way. If she wants to
Ask
go
her.
Friday for the scan,
She's going Friday for the scan.
let her decide that.
Okay, ask her.
I don't wanna do anything on Friday. I don't want to, I'm not gonna go to anybody's doctor.
No scan?
No, I'm not going in.
You're not going for the scan on Friday?
No, I'm not going in there. I never have that.
See, she doesn't even know what I'm
Leslie?
talking about.
Friday afternoon, Dr. Ashman wants you to go for a scan for your brain to check to see if there is any cancer spread to your brain. And that's what we are trying to talk about now and see, do you want to go for the scan or not? We are not going to look into what you're going to do after that. We just want to know if you want to go for the scan or not. And that's the question right now. And that's what I told Bob, that I want to ask you, because it is you, it's your life, and we want to hear from you what you want. And I think that's going to be easier for everybody if they know exactly what you want.
Do you understand what she's asking you? Do you understand what she's asking you?
I don't know.
What year is it, Les? What year?
What year?
Yeah, what year is it?
This year.
Yeah, this year, what year?
What about it? It's
What year is
November.
it? Tell me what year it is.
20 what? 20?
I don't know what it is.
What's your birthday?
So you see what
What's
I'm
your
saying?
birthday?
You understand me?
August 4th.
We-
I'm her surrogate.
We understand this. The reason she can't remember this is because the cancer is in her
Exactly.
brain.
So I'm speaking for her now.
No, you're not. You are not.
Don't leave, Bob. Don't leave. That's not going to accomplish anything. You have to. You've got to stay, Bob. We've got to. We have to.
Listen, I don't either. Look, this is
Yes,
for
you
Mom.
do. You
It
just-
is for Mom. She
I'm
has.
taking care of her
you have
the
been doing
best
an
that can
awesome
be.
job of taking
Okay,
care
so
of her.
That's it. Don't cause more and more.
I am here for Mom because she's dying.
She isn't.
Yes, she
dying.
is dying.
No, she isn't.
She is. That is why we are here, and
Now,
we
well,
need you to
shouldn't be here
understand
then,
that.
Because she's not
I'm not.
dying.
I should be here because my mom is
She
dying.
is not.
Yes, she is, Bob. That's why I'm
Yes,
here.
She is. I want to be with her. And take
Exactly.
care of her.
That's why
And I
we're
don't
here
need
to
all
tell
the rest
you.
of this world involved
That's
in
why
all
we are
this.
here to tell you so you
I
can
don't
be
need
with
nobody
her
to tell me anything.
and not drag her to doctor's appointments anymore. She's
I
done.
know that whatever she wants will happen. It's the way it's been. Period.
That's why we
If
are
she
here.
doesn't want to go Friday, she won't go. Period.
She doesn't understand that because of the cancer.
Exactly. So
That's
that's why
because
I make
it's-
the decision that we're going to go and have the scan.
Fine, you go and have the scan.
exactly what
If
happened.
there are more treatments to be had,
Whatever she'll decide then.
she cannot decide that. You just said a minute ago she can't decide
If she
that.
can't tell me what she wants, then I'll tell you.
She has told me repeatedly over the months that if it gets to this point, she's done. And we had this conversation a minute
She's
ago.
never said that to me ever.
Because she's not had those conversations with you,
She's
Bob,
not said
because
that
she's
to
been
me.
shielding you, because she loves you.
No.
Yes, she
She
has.
said that to Barb. did
She
say that
has.
to Barb.
It's, I understand this is difficult, Bob. It's
I
so
can't
difficult for
take-
all of
I
us.
can't take this.
I can't either, but we
Okay.
need to be sure and be here for Mom. Okay?
It is about Leslie, Bob. It's not about anybody but Leslie.
Well, what else would you suspect?
She had that conversation with Barb. She doesn't want to do anything else.
She said
she
that to
does.
me many times. Many times I sat here while she was crying to me that she wants to die. Crying to me.
Exactly.
She wants to die.
So
I've been through this a million
I know you have, but that's
times.
why we're having this conversation. We
I don't
can't.
need to have a conversation.
You
really.
do. We
No.
do. We
I
do
talk to
clearly.
her and she tells me what she just told me. She knows nothing what's going on. I gotta watch out for her now.
We all do. We all do. It'll all be okay.
I think
It'll all be
we
okay.
need to kind of, because I think it's very difficult for your mom to see
I'm sure it is. It has to be.
the arguments
Don't
going
be
on.
upset with
And
everyone.
so I think
Let's just
we have
stay,
to
and I
kind of
don't
keep the
know
arguments
that,
down.
I don't know if I'd ever want anything. Right as of now,
Well,
I've
who do you
got
want
my
to?
own-
Who do you want to decide for you?
I am, but I'm gonna wait and see, and I don't want anybody to have me for it or for.
She just can't get her words. She knows what she's trying to say. She just can't get her words.
Talk anymore, but I just want you to wait and see,
Wait and see what?
because we don't know. I don't know.
Wait and see what?
It's my business. If I do feel like, then it's mine. If that's what I'm waiting.
What if you can't?
But if I what?
What if you can't make the decision? You want me to do it for
It's
you?
already made, Bob.
This is I've never seen such a master thing. I've never seen such a.
Do you want to have the scan on Friday? That's the first thing to consider. Do you want to have the scan on Friday?
Bob, I can't read any place right. I can't walk right.
Then you don't want to have the scan.
Yeah, that makes me nervous.
You don't want to do it.
I don't, at this point, I
All
think
right.
business.
I'll call Dr. Ashman tomorrow, cancel, and find out what he suggests. And then you decide what you want to do.
Just have to see.
Okay? Okay, so nothing until tomorrow afternoon. She says she wants to do it, which she might very well. And then we'll do it. If not, we'll cancel it out.
Okay.
That's the answer.
That's something she did.
Okay.